Well, welcome to Valley View University. I'd like to thank everybody for joining today. I'm Dr. Scott Castle. I'm a board certified urologist. Just a couple of things before we get started. You can submit questions to the Q&A chat at the bottom of your screen. Your questions could be answered live at the end of the presentation. We'll try to best to answer all those. If we are unable to answer any questions if you put your personal health information in there. So this is HIPAA compliant, so don't put any birth dates or any personal information in there. Okay, we'll go ahead and get started. This one. Okay, today we're going to talk about erectile dysfunction, so understanding what causes it and what are treatments for it. So the big push nowadays is just to really work on extending lifespan. So extending lifespan means you're just increasing the duration of your life. Most of us are not interested in just living a long life. We want a healthy life that we have a good quality of life. So that's called health span. So we want to look at a group of things where we're increasing our health span and not just our lifespan. And that's kind of a change in medicine recently. So one of the things that comes with this health span, but is also a big quality of life factor, is what's called sex span. Sex span is the time of your life that you are sexually active. So for males, erectile dysfunction is very important at determining how long our sex span is. A lot of people develop erectile dysfunction but have no change in their desire to increase their sex span. Erectile dysfunction is where you're not able to achieve an erection that you're happy with so you can perform sexual activity. This occurs in 40% of men in their 40s, 50% in their 50s, 60% in their 60s, and it kind of goes up like that. Everybody's sex span has a endpoint, and then and that may be at your lifespan or maybe much sooner than that. So again, I'm Dr. Scott Castle. I'm a board certified urologist. I treat erectile dysfunction. I'm an expert in the care of this. I work here at Rocky Mountain Urology at Valley View Hospital. So let's talk about some just erectile dysfunction in general. Okay, so normal erection process happens when you are aroused. These nerves in the pelvis, they stimulate the penis. They cause the arteries to open and blood flow in. So if you look at the cross section of the penis, there's essentially three cylinders in there. The top two cylinders are the ones that fill with blood. So the arteries open here and then the veins compress, and that's what causes the erection. The bottom cylinder, the bottom cylinder is the what's called the corpus spongiosum. That's where the urine passes through. So typically, if somebody has erectile dysfunction, it's either an issue with not enough blood flow in or the veins don't keep the blood in the penis. Those are the most common reasons somebody would have trouble with an erection. Oh, let me go here. There's several causes of erectile dysfunction. Age is the one of the most common causes I mentioned. You have a determined period of time that you're going to be able to be sexually active, and at some point, everybody is not able to have sex in their life if they live long enough. Can't do anything about age. There are several other factors that are modifiable, or you can at least decrease your risk of getting erectile dysfunction. Some of these are lifestyle factors. Some of these are things that are a little more out of your control. If you see on this graph, about 30% of patients with erectile dysfunction have diabetes. About 40% have a vascular issue. The vascular issues can be caused by diabetes. It can be caused by smoking. There's lots of different things that are components in this. Uh, I'll mention very specifically about erectile dysfunction and heart disease. So erectile dysfunction can sometimes be a sign that you have underlying heart disease. So the majority of the people with erectile dysfunction have underlying heart issues. So the point of this is not something to be ignored. If you're having erectile dysfunction issues, you should see your healthcare provider, not just because you want to get the erections fixed, but also to see if you have any underlying health conditions that could be causing this. Okay. The idea is if you see the circles at the bottom, the blood vessels that go to the penis are very small, whereas the blood vessels that go to the heart are about twice that size. So if you have a blockage in a blood vessel in the penis, it's going to show up sooner than it is a blockage in your heart. So just very important thing if you have erectile dysfunction to understand you may have a heart issue that's also present. So here are some things for prevention of erectile dysfunction that are do's and don'ts. Do exercise. There is almost no better all body benefit of anything other than exercise. That's a very important thing. Most of the things we talk about are going to be healthy for you overall, and most things that are healthy for your whole body are going to be healthy for the penis and for erections. Okay. Do eat well. People who do not eat well are more likely to get erectile dysfunction and get all those factors we talked about earlier, which are the diabetes, the vascular issues, and those kind of things. Do reduce stress. Humans are evolutionarily very designed to have very short periods of stress, like I'm getting chased by a bear, I got to run. And then your body's going to say, well, next time I'm going to make you a little faster and be able to get your blood flow and your muscles better so you can run from that bear better. If you have chronic, meaning long-term low level of stress, that has a negative effect on our bodies. And we do think that that negatively affects erectile function. So we do want you to reduce stress overall. Do stay sexually active. The penile tissues, there is some muscle in there, and these help compress those veins so they close properly. If you are not using your penis often, you lose some function over time. What I tell people is this is similar to if I told you don't use your right arm for a year, the muscles would shrink and it wouldn't be as functional. So there is some use it or lose it with the penis and erectile issues. Um, we do recommend that goes along with that if you ejaculate more frequently. There's been some studies showing that if you ejaculate 21 times per month, you are less likely to develop prostate cancer. So that just comes along with the use it or lose it kind of idea for this. Um, do get routine screening. It's important, especially males who are over 40 years old. Get all the regular blood tests checked. Make sure you don't have high blood pressure, diabetes, high cholesterol, low testosterone, thyroid disorders. All these things can affect your whole body and can affect erectile function. Some don'ts. If you are not diabetic, don't get diabetes. Or if you do already have diabetes, make sure you keep it under control. Diabetes damages the blood vessels and nerves, which tell the erections what to do and allow for that blood flow to go in there. Don't develop high blood pressure. It's the same story. This will damage the blood vessels which go to the penis. Don't smoke, vape, or use marijuana. The smoking and the vaping, the nicotine damages these small blood vessels. Marijuana causes hormonal changes that can make it more difficult and more likely to have erection issues. Same thing with excessive alcohol. These are not good for erectile dysfunction. Don't use illicit drugs, cocaine, methamphetamines, those kind of things. I think that's pretty obvious for most people, but those things are not good for overall health and overall erectile function. Pornography is also something very important not to use. Your brain gets hardwired to expect a certain result. And then when you try to apply to real life situations, sometimes your brain can't produce the same erection because it's very hardwired from pornography use. So that is also something I recommend you do not use. There are several medications you could be taking that could cause erectile dysfunction. The way I would look at all of this, these are all additive, right? You add your age in there, you add some medical conditions, you add, if you're inactive, you don't exercise, those kind of things. All these add up and contribute to this. So if you come see the urologist and you have an enlarged prostate medication, some of those do cause erectile dysfunction. And so it's good to discuss that if you're having that issue. Some treatments we do for prostate cancer, these are hormone therapies. They can make you have erectile issues. Blood pressure medicines are sometimes a culprit. Sometimes there's somebody who is just on one blood pressure medicine. If they do weight loss and exercise, they might be able to get off of blood pressure medicine. Other medications which have a more psychological effect, antidepressants, and then things like benzodiazepines and narcotics. These are overall just suppressants for our whole bodies. So they kind of uh, cause anything to be less likely to occur. So narcotics do that, pain medicines in that group. Things like Tylenol, ibuprofen that are non-narcotic medications are totally fine. There are some other things that could cause erectile issues. So psychogenic erectile dysfunction would be erections that are occurring, but there's not a blood flow issue to the penis causing those. This has become more and more common with people that are younger. So just some mental health problems. If you are depressed, you're less likely to have normal sexual function. These are also, interpersonal relationships with your partner. So a lot of times therapy is an option for patients who have mental health issues or these relationship issues. And again, this is well proven. There's such thing as pornography-induced erectile dysfunction. Again, it's just this brain hardwiring that is hard to break when you're put in a real life situation with another person. So I want to make a comment about erectile dysfunction and prostate cancer treatment. So unfortunately, prostate cancer treatments pretty much all cause erection issues. Our two most common prostate cancer treatments are complete prostate removal. It's called prostatectomy, and then our other one is radiation therapy. The prostatectomy surgery probably causes that a little bit more, but the radiation also causes that. The nerves and blood vessels which supply the erections are essentially attached to the prostate. These get scooted around during prostate surgery. And then when you have radiation, they receive some radiation. Now, I do want to clarify, I'm talking about prostate cancer treatments, not enlarged prostate treatments. Enlarged prostate treatments can cause ejaculation issues, but typically don't have an effect on the ability to get an erection. There's some other surgeries you could have done that could also affect your erection issues. Most of these are things that have to do with surgery on the pelvis, and that has to do with the nerves that come out of the spine there. Also, just spinal surgery anywhere in that lumbar or sacrum region. Those nerves come out and they tell the penis what to do as far as allow the blood vessels to open and get blood flow into the penis. So if you've had a history of any of these surgeries, this may cause erectile dysfunction for you. Okay. So, what do we do about all this? We already mentioned the do's and don'ts about lifestyle changes that you can do to help prevent, and they're even helpful in some people that already have erectile dysfunction. Um, there's a lot of stuff online now about supplements and then these online prescribers. I tell everybody to be wary of these kind of things. So, a few things. Over-the-counter supplements, most of them are not harmful. They are, however, not regulated by the FDA. They've done studies about erectile dysfunction supplements, and about 25% of them contain either sildenafil, which is generic name for Viagra, or tadalafil, which is generic name for Cialis. So a lot of times what they're selling you is actually prescription medication, but they're not actually disclosing to you that it has a prescription medication in there. There's also been higher levels of heavy metals in a lot of these supplements. And then there's other thing I've kind of seen there's some advertisements for apomorphine. These are kind of a direct to consumer advertisement. This is an older medication. It's supposed to help with arousal. It has a high side effect profile. You just have to make sure if you're interested in something like that and you have a provider who's prescribing it, make sure they're aware of all your medical history and that there's not going to be something that's going to interact there. And the last thing is a lot of times these things are expensive. Nowadays, sildenafil and tadalafil are actually pretty cheap medications. These are erectile dysfunction medications. So a lot of times it's not a big deal to get your regular health provider to prescribe those medicines for you as an initial step if you've tried some lifestyle changes and this has not helped your erections. So if you come see a provider such as myself, we'll kind of go through a gamut of some different options for erectile dysfunction. So there's oral pills, vacuum devices, injections, and then even surgery. So the oral medications, these are real common. We prescribe a lot of these. The first two on there, Viagra and Cialis, are the most common medications. These are very cheap these days. They do start at a lower dose, and we kind of try to figure out the right dose for you. They do have some side effects. Viagra, it's about 11% of people get a side effect. They get some nasal stuffiness, their face feels flushed, they get heartburn. The Cialis or tadalafil, you can get back pain. All these are reversible side effects. I mean, if you take them, they'll go away. There is some risk of what we call priapism. That means you have an erection that lasts too long. Typically, that's at a 4 hour mark. I've prescribed, a lot of patients these medications. I've not seen anybody have that reaction to the medication. It's a known risk, but really it's a very low risk for these kind of things. So in general, these are very safe things. The person who needs to be cautious with taking these, when people ask about heart health, there's two things. One, if you take a medicine for angina, such as nitroglycerin or isosorbide, you can't combine it with these medicines. The second thing is, if you are not active at all, if you cannot walk around the block one time, you may not be a good idea to have sex because that could be enough exercise for you to cause a heart issue. So those are the only two groups of people that I would be worried about starting one of these medications. But for the most part, they're very safe and pretty well tolerated. And again, if you get a side effect, it's temporary. These are some other non-medication options we'll go over. This is a vacuum pump. Essentially, what happens is you put this cylinder around the penis, it allows blood flow in. You put a band or constriction ring around the base of the penis to keep the blood flow in there. I would say about half the patients I take care of are able to use this. You don't actually have to have a prescription for this. They sell these online. We do write some people prescriptions for these, but it's just sometimes can be hard to get it to seal properly and those kind of things. So this is a non-medication option that is available for some people to try. We also do penile injections. This is where you're actually injecting a medication into the penis itself. These are probably the best medication-wise as far as strength of medication. You get an erection pretty much right away. So this is probably more common for the patients that have had erectile issues for a long time, or if we do surgery like prostatectomy surgery, remove your prostate. This is a more common thing we see patients using. Some patients don't really want to give themselves an injection. A lot of the diabetic patients who already inject insulin, they don't have a big issue with giving themselves an injection. There's a couple of newer things that are out now. This is low intensity shockwave treatment. This is an option for people who have very mild erectile dysfunction. So that would be somebody who's not even to the point where they require a medication such as a Cialis or a Viagra. This is usually cash for most people. We don't offer this at Valley View, but there's several places in Colorado and Denver and also in Grand Junction that do offer this. So this is a non-medication option for patients with mild erectile dysfunction. There's always going to be an option if it's important for you to have sex and you can't find something else that works. We do a procedure called a penile implant. This is where we're actually putting in two cylinders, a pump, and a reservoir in through a surgery. So this is Boston Scientific just made new prosthesis this past year, and this is when we put our first one in earlier this year. It just utilizes a special pump called Tenatio. Um, like I said, there's two cylinders which go in the penis here. You can see from this diagram. There's a pump in the scrotum, and then there's a fluid reservoir which sits right next to the bladder. When you are ready to have sex, you pump up these two cylinders, and then when you're finished having sex, you press a valve and it deflates. This gives you the most on demand. You can get an erection whenever you want to. It doesn't have to do timing of medications. And the downside is it does require a surgery. This is typically done outpatient, so you have general anesthesia, you go home the same day. You wait about 4 to 6 weeks till you can use the device. It does have one of the highest rates of satisfaction. So of patients who have one, 97% would recommend it to a friend. So if again, this is for people who it's very important for them to stay sexually active, and we can't find another solution for them. So the penile prostate surgery does have some risk, and these do include you might have to have a second operation. There's a low infection risk; it's about 3%. So the point of that is it's not a zero risk procedure. And for talking about being sexually active, we're not talking about cancer. So it just has to be important to you to be sexually active to undergo these potential risks. So here, this is just a website. If you want to look more at a penile prosthesis, there's some more information. You can do this edcure.com. It also has some of these other options I mentioned about the vacuum pump and the injections and those kind of things. So really, what's the overall picture? So again, as we increase lifespan with our population, and most of us want to increase our lifespan, we're going to try to increase our sex span and how long we're sexually active. So we talked about those do's and don'ts. You want to do your best on prevention when you're younger and not just wait till you have erectile dysfunction. Make those lifestyle modifications. If you get to a point where you still have erection issues and you can't, the lifestyle modifications haven't helped you, um, you may, be a candidate for trying a medicine. Also, just, make sure you're getting checked out, make sure there's not some other health issue that can potentially be causing this. If it's important for you, there's always, as mentioned, several things that you can have done to get your erections fixed. So don't give up hope and think there's nothing that I'll be able to do. And this is a topic that is not talked about very much among men. So a lot of times people ignore it and just, forget about it. So, your primary care doctor is a good place to see. We also see patients that are self-referred. They just call us and schedule for our office. So that's all the information I wanted to present today on erectile dysfunction. Um, we'd like to hear your feedback on today's presentation. If you have any, there will be a quick survey. You'll get an email in the next 24 hours. And then we'll go ahead and open up for any questions that come across. Maybe this last part.
Are eye conditions like central serous retinopathy a side effect of these medications?
So the question is if eye conditions like
Central serous.
central serous retinopathy cause a side effect of these medications. We don't believe so. So what the link would be is that medications, specifically Viagra, which is sildenafil, they work on a molecule called phosphodiesterase. Phosphodiesterase is in our body. There's different types of it. And there's some cross-reactivity between the ones that are more common for the blood vessels that supply erections, which is called phosphodiesterase 5. And there's one called phosphodiesterase 6, which is in the retina. So people can get this blue vision. But to my knowledge, that's the only potential vision side effect of these medications.
How long can you be on testosterone before it affects penile function, or is this dependent person to person?
Yeah, so the question is, how long can you be on testosterone before it affects penile function? So testosterone is going to generally help penile function. Testosterone is most closely tied to libido. It doesn't really do anything to help that blood flow into the penis. So if you have low testosterone and you're put on extra testosterone through an injection, a gel, oral medication, your testosterone will go up and your body will stop making its own testosterone. So if you are on it long enough and you come off testosterone, your body won't make its own and that testosterone number will go down. But testosterone should not cause erection issues. It should only help erection issues. But it won't fix a blood flow issue. So if your testosterone is corrected and it doesn't help your erections, you should be looking for a different cause of that. Majority of people, the cause can be one of the two things. Not enough blood flow in, meaning the arteries are clogged, or not, the veins are not closing to hold the blood flow into the penis. Okay, we'll go ahead and take our next question.
Is there a minimum level of testosterone dosage that you can supplement if you have prostate cancer or recurrent prostate cancer?
Yeah, so the question is there a minimum level of testosterone you can give for people that have prostate cancer or recurrent prostate cancer? So there's generally a few groups of people that we feel safe giving testosterone, and there's lots of data on that have prostate cancer. And there's some people that we're not sure and we don't want to do something unsafe for you. If you have prostate cancer is mostly fed by testosterone. That is part of what feeds the tissue to help it grow. If you have a group of what we call low risk prostate cancer, these are typically people who are on surveillance. We know it is safe to give those people extra testosterone, and you could have a level up to what we would normally try to get you at. The testosterone level really, there's not as much stimulation to cause the potential prostate cancer growth above 250 or so. So it just has to do with those real low levels. So is somebody who we deem is a candidate that has prostate cancer, we're going to try to get you up to what we call a physiologic level. So the second group would be, okay, I'm somebody who I just got diagnosed with prostate cancer. That person, we might stop their testosterone because we don't know what's going to happen, what the behavior is. So then on the other side, let's say you got treated for prostate cancer. If you got treated and you have some good stability and you have no recurrence, we're going to feel it's safe to give you testosterone. The people who have a recurrence, some of them we might feel it's less safe to give, and we typically would not. So that would be an individual discussion with either your urologist, your radiation oncologist, or somebody who's treating your prostate cancer.
Is erectile dysfunction an effect of ADT for prostate cancer? And if you do get ADT, do erections ever come back?
So the question is erectile dysfunction an effect of ADT, which stands for androgen deprivation therapy for prostate cancer? And the answer is most definitely yes. Almost every person who gets put on ADT gets erectile dysfunction. So what I tell everybody, when you're starting that medicine, your testosterone gets very low. So if you have if most, 20-year-old males testosterone is between 700 to 1,000, if you take that medicine, excuse me, take that medicine, your testosterone is going to be 50 or less. So much, much lower. Your libido will just go in the toilet. You won't have much sex drive. So if you get a androgen deprivation therapy, the duration depends on when will it come back. So if you get a 3 month, we call that a depot, a shot. So let's say in January you got this shot. That means that it is no longer in your system in April, but it could take 6 months or more for your testosterone to come back to normal. So I would count the date from when the androgen deprivation therapy was given, and then how long it's expected to go, and then 6 months after that. If your testosterone comes up, then the erection should come back with that. But it just depends on the time frame. If several years go by, you're now adding several years of age to it, and there's other factors in there. But most people, if they once they come off that, if they rebound their testosterone, they're going to go back to their previous function.
Is there an issue with long-term usage of tadalafil?
The question is there an issue with long-term usage of tadalafil? Currently, we do not think that there is. Last year there was a study that came out that said that people who took sildenafil, which is the other erectile dysfunction medicine that's generic Viagra, actually lived longer. We don't know if that was the medicine caused that, or that the people who had that increased sex span, they were sexually active longer, were just healthier individuals. Tadalafil is typically a very well tolerated medication. We don't believe there's any long-term side effects. It's been around for probably at least 20 years at this point. So I don't see any problem with being on long-term tadalafil.
Is there a maximum amount of sildenafil that you should take or that should not be exceeded daily?
Yeah, so the maximum doses of the erectile dysfunction medications, so for sildenafil, which is generic Viagra, it's going to be 100 milligrams. For tadalafil, which is generic Cialis, it's going to be 20 milligrams. Levitra is also medicine, but that's more expensive. We don't have very many patients on that. So those maximum doses are, there's only so many circulating molecules that it's going to affect in your body. If you go above that dose, you're much more likely to get a side effect. So we don't recommend above those limits of 100 milligrams for sildenafil and 20 milligrams for tadalafil, but you could take that maximum dose every single day.
Does ashwagandha or other herbal supplements actually help increase blood flow for AD?
So a lot of the supplements, they're not very well studied. So the question is specifically about ashwagandha. So again, what I mentioned is if you buy an over-the-counter supplement, there's a 25% chance that what you're buying has Viagra or Cialis in it. So if you just had the ashwagandha by itself, it's just not been studied. What I would say about ashwagandha or a lot of these supplements is if you know the quality is good, that they're not adding these other things in there, they are probably not harmful things to do. And then it's just on an individual basis. If it's not expensive and it's affordable, you can always try and see if it's helpful. But most of those have a big placebo effect, meaning there is more of a psychological effect they have on you. So really it's kind of an answer we don't know the answer to. From personal experience, I don't have a lot of patients that are on that have told me that they've had improvement in erections. But I think most people take it for sleep issues and they aren't starting it specifically for erection issues. So really, I don't know the full answer whether ashwagandha is helpful or not.
Does age affect how much you should be ejaculating or for the average 21 per month?
So the question is, does age affect how much you should be ejaculating? So when they did this study of people and looked at that 21 ejaculations a month for prostate cancer prevention, they didn't break it down by age group specific. So it's kind of just a broad recommendation. It just says it's to be helpful. I would take it with a grain of salt, meaning that there's some thought to if you get rid of all the fluids and secretions in the prostate, if you're only ejaculating one time a month, I think most of us would think that probably doing more than that would be healthier for your prostate. So 21 is quite a few ejaculations, and for a lot of people, that's not reasonable. So I would just do the best you can, but that's just kind of the study said, but it was not broken down by age. So we don't know if one age group should do more or less than that.
This will be our last one. Does aquablation cause the reduction of volume in your system when you ejaculate?
Yeah, so the question is about this surgery, which is called aquablation, which is for enlarged prostate. Does it reduce the amount of ejaculation when you ejaculate? The answer is yes for some people. So all the enlarged prostate treatments, the oldest one being TURP, transurethral of prostate, and then aquablation being one of the newest ones out there, can cause ejaculation issues. TERP is almost 100% of people get that or very high, 80 to 100%. Aquablation, we typically see with our patients about 20% get ejaculation issues. Now, that being said, if you are somebody who's looking at that procedure, you should tell your provider, I want to preserve the ejaculations, and there are some tricks we can do during the procedure to make you more likely to preserve your ejaculation after surgery. So. All right, I think that's all the questions we're going to take today. Thank you, everybody, for tuning in today. Our next Valley View University is Thursday, September 25th at 12 p.m. with palliative medicine doctor Shane Lieberman. He'll present on what palliative medicine and how it can help you and your loved ones. Thank you, everybody. Have a good day and have a good afternoon.